A mother called the police to get help for her suicidal teenager, and the police sent a SWAT team. Now the teen is in the hospital fighting for his life. Let's get into it. So today at 6:24 a.m., a Jacksonville mother made a desperate call for help. Her 16-year-old son had left home armed with a handgun and a note indicating that he planned to take his own life. Now, she did exactly what she was supposed to do, but what the Jacksonville Sheriff's Office delivered was a military-style response. We're talking SWAT teams, armored vehicles, tasers, pepper ball rounds, and an incident that ended with a teenager shooting himself in the head. Now, according to JSO's own press conference, officers located the teen within minutes and fired a taser and gunshots, both missing as the teen fled into a parking lot. Yet the Behavioral Crisis Response Unit wasn't called in until 8 a.m., nearly 90 minutes later, and even then, only by phone, kept safely away because the scene was too dynamic. Now, around 9:15 a.m., SWAT used armored vehicles and pepper balls to push the teen around the massive parking lot like a military target, deploying pepper balls to push him east until he put a gun to his own head, ending the standoff with the teen transported to the hospital in life-threatening condition. And this is not crisis intervention. This is a tragedy that should have never happened. Now, this case is far from an isolated incident. It's part of a devastating pattern of JSO mishandling mental health emergencies. In August 2025, Brian Gillis, a 30-year-old with a documented mental health history, was shot and killed by a JSO officer while he was experiencing a mental health crisis. In October 2025, Rashad Martin's mom called for help when her son was in the middle of an episode, and JSO killed him and still refuses to tell his family what really happened to him. They've held on to body cam footage and refused to be transparent. In June 2026, Kean Atkinson was shot multiple times by officers after JSO had already responded to 8 prior mental health-related calls at the same address. These are not anomalies. They are the predictable outcomes of a system that sends armed police to do the work of mental health professionals. Also, I can't help but briefly mention the double standard here. In this case, JSO is withholding the 16-year-old's name due to department policy, and his name should be withheld. But when 14-year-old Rayshawn Knight was arrested after a dog was sicked on him, JSO had no problem releasing his name to the public. They even smeared him and adultified him in an attempt to justify sicking their dogs on a fleeing child. So releasing a child's name is fair game when the department wants to control the narrative, but protected when it might expose their own failures? And let's talk about what information JSO did release about this teenager. In the press conference, the department made a point of mentioning that this 16-year-old had been expelled from school in 2023 for making threats, an incident that this kid wasn't even arrested for. They smeared a child who was in crisis, broadcasting his mental health history while he lay in a hospital bed fighting for his life. That is what they do. Look, at the end of the day, Jacksonville doesn't need more SWAT teams rolling up on literal kids in crisis. It needs a dedicated, fully funded mental health emergency response team, professionals trained to de-escalate, not escalate. Nearly 40% of the city's yearly budget goes to JSO. It's time to redirect some of that money toward actual community care. The community has been demanding this for years. How many more families have to bury their loved ones before the city listens? A mother called for help. She got a SWAT team. That is not help. That is a failure, and Jacksonville deserves better. This is Monique with the Black Belt Daily signing out.